Right. Today also we are going to discuss about the middle cerebral artery. Middle cerebral artery. This is most important arterial supply of the brain. It's connect to the both side of the circulation supply, carotid arterial supply and vertebra basilar arterial supply, both to connect to the circulation of villi. Then it's divide the lateral aspect of the cerebral hemisphere, two lateral side, left side, main middle cerebral artery supply give the left side and another main arterial supply give the right side. Why this middle cerebral arterial circulation most important? Lot of internal brain organ supply to the main blood circulation supply of this middle cerebral artery. When divide the brain two parts, it supply to the separate two hemisphere, separate middle cerebral two arterial supply. The left side is the most important. It is also the most dominant side. Why the right hand connect to the left side of the brain? This main middle cerebral artery due to proximal part, it is also the main organ area. Distal part, lot of are connect to the brain cortex. This is most important. We discuss this cortex supply and middle proximal supply before. Now we are going to discuss the today most important part about this middle cerebral artery. When the brain cortex, we consider the cortex area, in young adults person, the young adults people, year 18, year 25 likewise, year 18, year 25 likewise, young adult, small students, these to 18 and 25 around years people, they have some form of damage of this middle cerebral arterial supply. It is happening to inside the brain. Lot of are happening to the dominant side, left side. It can be a congenital cause to the congenital happening circulation problem. Name is the AVM. We know the AVM. AVM is the most important. AVM. This is the name. AVM is the most important to discuss. Why the young adults happening to this AVM? Lot of happening to The elders also they can happen. The small children, teenager also they can happen. Lot of we can target to the 18-25 years old young adults person to happen AVM problem inside the brain. AVM is the stand for arterial vein malformation. This is the arterial vein malformation. Arterial vein malformation. Arterial vein malformation. When the arterial supply of the brain, most important to the arterial supply of the brain, it is connected to the vein circulation supply, return to the heart, and from to the heart go to the brain and return to the heart to the from to the brain and to the heart. This is the it's connected to the inside the brain, arterial and vein, lot of network connection inside the brain. This the arterial vein malformation is the main deformity happening to the hand and leg, paralysis deformity, and speech problem can be happening to the this problem, arterial vein malformation. Right, today we are going to discuss about this arterial vein malformation briefly. The middle cerebral arterial supply of the brain this is the supply. The arterial area divided some form of small arterioles and small supply. Then it can be some form of connect to the network and connect to the rolling and this thread like rolling like situation inside the brain, this arterial supply. Then it connect to the vein. This is the some form of another situation, arterial vein malformation. Some form of we can identify this situation. Arteriolar, the small arterial circulation supply, the rolling likewise situation of the inside the brain, then it connect to the venous return. This is the some form of blocking situation that come to the circulation, this circulation perfusion this way, and it roundly and it's arranged to the round situation and then go. The pressure more high to the proximal area, the inside the these arterial supply, it can be sometimes blast and hemorrhage inside the brain. This is some form of another situation to the inside the brain. Another one we are going to be discuss. Sometimes it can be happen to a lot of branches, small branches connect to the venous side. This is also another situation. Small branches can be. This is also another situation to the arterial venous malformation. The come to the circulation this area and go inside this arterial vein situation. Lot of pressure can be happening to the proximal side, can be blast this some form of this small arterial vein supply. It is also the another situation of the arterial vein malformation. Another one we are going to discuss inside the arterial supply. This is the arterial supply, and lot of very light area, and then go to the venous return. This is also can be happen. This is the arterial vein malformation of the inside the brain. These three we can discuss the inside the brain, young adults people, why it is happening to the inside the brain, and what is the sign and symptom of this situation. This situation is the normal. Sometimes their brain pressure, circulation pressure inside the brain go up, then this area can be damaged. That is the most important to we have to identify this arterial vein malformation area. Right, now we are going to be discuss how we can identify this situation. This is the small person, right? This is his arm, finger, right, right. This is the trunk and leg. This area this lateral aspect of the skull, parietal, temporal region, it is damaged too due to middle cerebral arterial vein malformation inside this area happening. Arterial vein malformation. Arterial malformation happening inside the brain due to this region can be patient feel severe headache. The first one is the severe headache. Severe headache can feel this arterial vein malformation person, and then he can identify the finger, some form of finger coordination problem, and writing difficulties, writing difficulties, numbness, loss of strength, loss of strength, numbness, loss of strength, shoulder pain also can feel this person. Then the visual area also that we can discuss. Visual area. Sometimes kinetic movement reduce. Then we can identify some form of tenderness, some area, some form of strength of the shoulder, finger, elbow area reduction gradually. Leg also we can feel these things. Uncoordination walking. This is the walking. There's a uncoordinated walking, and the walking gait also the change, and sometimes leg some form of normal sestrans gait also the change. Then the pain also can be happen to the leg. Sometimes then he walking fell down sometime. This is also the can be happen. Severe pain, we can see the severe pain of the leg or trunk area. Leg or trunk area, severe pain we can identify the leg and trunk area. Severe pain. Numbness also we can feel this leg area. In the visual field also the sign and symptom before gradually happening to this problem, sign and symptom, the visual problem we can identify. Sometime person can't dilate pupil and constrict pupil due to cranial nerve problem, due to damage of the brain, and the speech problem also that we can tackle. Speech problem, speech problem also that we can tackle. Swallowing problem. These some form of previous sign and symptom we can identify. Again, I am going to discuss. Due to malformation of the inside the brain, age 18-25, this person also a lot of brain use time because they are studying and lot of exam they have to 18 and 25 years old. They using lot of brain function to the education purpose. Due to this stage, a lot of stress are happening inside the brain. They feel some form of finger and some form of legs area uncoordinated movement, and writing difficulties, walking difficulties, or running difficulties, and some form of continue activity difficulties due to this reason. Then the speech also that we can tackle the speech area also some form of he can't speak purposefully and continuously. They block the speech and some form of words and some form of special alphabet not properly out. Then the visual field also that we can identify the some form of a small problem due to this AVN. Right, we discuss the some form of a special thing, how we can identify the before, the pain also the most important, how we can identify the before this malformation and AVA, after before and after. This is the most important to brain before and after. What are the major point we can tackle to this arterial vein malformation? Right now we are going to the draw about the middle cerebral artery and other circulation of villi. This is the some form of a small drawing. Right, this is a small cervical of circulation of villi. This is the carotid artery. Then it's got the lateral aspect of the brain. This is the middle cerebral artery. These are the proximal point, distal point. We know the brain cortex. Right. This is the insula area. Then we discuss cortex area. We know this area. Right before arterial vein malformation, how we can identify? Just the small point we can identify the previous we have discussed this thing. After damage, this is the damage after arterial vein formation damage. Blast. That arterial vein malformation area blast, sometimes stress inside the brain go up, and lot of are happening to the The small teenager person, they are watching television lot of time. That is the most bad situation. Lot of time they are watching television, and he can bear this that situation. And lot of time they are studying, and stress come to the brain, and it can't bear that person, and can blast this arterial vein malformation area, right? Due to this middle cerebral arterial vein malformation area blast, then the inside the brain circulation perfusion blocked to blast distal part area, block this circulation. And inside the brain, this circulation, a lot of perfusion blood collect to the inside the brain. That's the most severe case. Due to this reason, after the middle cerebral arterial AVA blast, due to this reason, inside the brain can be go high to the intracranial pressure. That is also the problem. Why the intracranial pressure go high? Due to this reason, we know the visual pathway, visual pathway, the visual cranial nerve. We know the cranial nerve 2, cranial nerve 3, cranial nerve 4, cranial nerve 6. A lot of cranial nerve compress to this intracranial pressure go high. Then the doctors must release the intracranial pressure. It is also the most important after blast this arterial vein malformation area. The blowholing apply and remove the blood inside the brain. Then the neurologist and they can remove the skull. This is the temporal region area. Remove the skull. It is also the some form of releasing to the remove of the skull. That is also the can be done to release the intracranial pressure. Right? Due to this blast of the arterial vein malformation area, then the lot of synapse syndrome can be happen after this situation. Patient also the initial stage is the mainly intensive care unit. He can severe to the brain damage, and 2 weeks 1 month also stay in the intensive care unit. Then the after come to the normal ward, we can identify the